joined by Professor Spanjol to talk about innovation in healthcare. So, Professor, can you introduce yourself, what your background is?
Sure. So my name is Spanjol, and I'm a Professor of Innovation Management here at the LMU Munich, so at the LMU Munich School of Management. Specifically, I lead the Institute for Innovation Management, but I'm also the chair of the LMU Innovation and Entrepreneurship Center, and I've been at the LMU for about 5 years. My background is really, I studied in my PhD business administration. I had a focus on marketing strategy, and cognitive psychology. And from the beginning, I was interested in innovation because it is complex. There's lots of uncertainty. There are a lot of factors that go into it. And really, if I'm thinking about innovation next to, let's say, accounting and finance and all the other kind of business-related disciplines, to me, innovation is the one way in which organizations, whether they're for-profit, not-for-profit, whether they're NGOs or whatever they may be, innovation is really about problem solving.
And what is your research focused on right now?
So I have several different streams going on in my research right now, but I think the most relevant to this conversation is the research in the healthcare domain, and particularly research projects that look at consumer experiences within the healthcare service system. And specifically, I'm interested in understanding how chronically ill consumers in their role, so not just users of healthcare services, not just in a patient role, which have all different connotations, but in a consumer role, how they navigate these often highly fragmented healthcare service systems over longer periods of time. So my research has been looking at healthcare service consumption as a negative service consumption, so things that you really don't want to engage in, and that it is part and parcel of chronically ill individuals' experiences, right? It's not an acute problem that gets relieved. I'm interested in understanding better the consumer journey over time. So this notion of striving through healthcare services consumption towards well-being. And more recently, I'm working with one of my doctoral students on understanding how pharmacists, so now going out of the consumer into the provider perspective, but how pharmacists and pharmacies that we as individuals, as patients, but also generally consumers interact with very often, how pharmacists and pharmacies can create new value because they're really close in interacting, often without appointments, etc., with the public. Well, innovation in healthcare, when we're thinking about this, we have, what do we have? We think of immediately, well, innovation is new medicine, granted, but that's not what really I'm interested in. So it's not pharmaceutical developments. Or you think about innovation in healthcare as new medical devices, right? Robots doing surgeries, etc. This is all super important. What we're looking at, and why we think, so my colleagues and I that have been working for years now together in this domain, what we believe is that a consumer perspective opens up and takes into account the entire kind of lived experience of an individual. And how they move, but not just within the healthcare service system, but also between the providers and their home environment. And I know there is kind of this integrated patient-centered home idea that has been developed in medicine, etc. We're trying to push forward also by bringing theories and empirical findings from the consumer behavior literature to bear upon medication adherence. And so if we're just thinking about this as a patient with interventions, then I think we believe we lose that holistic perspective. And so instead of so then also the innovation opportunities will be different, right? So it's not just about the effectiveness of the treatment. It becomes the how do we create solutions, whether they be tiny, in supporting consumers, individuals, in striving for health over longer periods of time in their own environments, right? Because consumers really co-produce their well-being, they co-produce the adherence, they co-produce services, and so we kind of forget that aspect. Well, we don't really forget, but we don't actively take it into account when we're thinking about innovation in the healthcare domain. So one of the things that we would love to see and that we've recommended are, for example, additional roles, new roles, expanded roles, such as there are already community health workers, for example, that help in translating that technical expertise that is coming from the healthcare service system into the consumer's lived experience, into their home environment, their neighborhoods. We've developed recommendations around the importance of spatial kind of neighborhood solutions, let's say, to put into place where the problem is not the motivation of the individual to engage in healthful behavior and medication adherence, let's say, but the neighborhood, the community, the setup, the building, all of this is really impairing the possibility and the ability of the consumers to enact their intention for that active striving for well-being. And that is what we believe we bring to the table. And it's been very important to the team to be working in an interdisciplinary manner. So we have pharmacy administration, we have medical and health psychologists, we have practitioners, so medical practitioners as well, who come into the team. But then also on the kind of business side, we have some marketing, information systems, etc. So different perspectives coming together and trying to gauge kind of the problem in a more holistic way.
Yes, so viewing as a whole rather than focusing on small details.
Right.
So for you, innovation in healthcare is more to do with influencing interventions.
Yes, well, interventions, service system design, the need for different roles in the healthcare service system based on what we observe with consumer experiences. So I think it runs the gamut. It's just that's a challenge, actually. When you're publishing in academic journals, particularly in the domain of management or marketing, we like the theory part, but then getting that, it's actually one of the challenges that I think is more specific to my field, getting that those findings into the hands of policymakers or into the hands of healthcare service system providers, etc. That's a continual challenge. And that's why we also think that interdisciplinary work with colleagues out of the healthcare domain is so important, because it lets us be grounded, and also opens up, we can talk about where should we go with this, who do we need to talk to, and we try to publish as well in the medical kind of healthcare journals.
What should we take away from this conversation?
I think what I'd like people to take away from this conversation is that interdisciplinary work with researchers from the business school, from the School of Management, from the Management Business Administration domain, actually carries some opportunities. I think we have perspectives onto the same problem and that are complementary. And because in the work by management scholars, and we focus on a lot on theoretical explanations, the hope would be, I would like people to take away that there are certain expertise domains where we can help explain why maybe something is working or not working. We really I started out, I'm trying to think, about 10 years ago or so, with looking at medication adherence, because I was struck by the statistic of, on average, medication adherence hovers around 50%. For some diseases, others it's a little bit higher, etc. And many interventions that have been tried out maybe work during the time of the intervention, but then when that is stopped, then the problems come back up, right? So, and adherence kind of goes up and then down again. And so it keeps kind of going and hovering around this 50%. And it took me about 6 to 7 months of reading all the meta-analyses and reviews, etc., because I just couldn't believe that there isn't an answer that has been figured out. But again, because of the complexity of and the contextualization and the specificity of each individual's own experience, you can aggregate into certain bigger problems, but in the end, it's always the individual and his or her own kind of environment that can change and that requires different solutions. So when I saw the statistic, I thought, well, there's something that we can bring to this, because we really understand the complexities of consumer decision-making, actions, preferences, behaviors, etc., and how that is being shaped. And so that was really the start of the collaboration. And I would still hope, after all of these years, that is something that people would recognize and kind of take away, that interdisciplinary work across, what looked like relatively far apart disciplines, that there is promise to it. And I think at LMU and within EUGLOH, this has been super exciting to see that people are coming together from different disciplines, from different perspectives, and exchanging across different topics. So I've been very fortunate to be part of the dialogue.
Thank you very much for your time.
Thank you.
It was great learning more about innovation in healthcare from your perspective.
Thank you. Thank you very much.